Good day, folks. This is Hippocrates.terra, and today we're going to be talking about the kinase inhibitors that are used as anti-cancer drugs, chemotherapeutics. So these are fantastic drugs that are exceptional at targeting specific cancer cells and shutting down their growth. So the first one I'm going to talk about is imatinib. Imatinib works especially well on CML patients, as it's a small molecule tyrosine kinase inhibitor. So what is CML? CML is chronic myeloid leukemia. And what you see with this is a very common leukemia that happens in myeloid progenitor cells. So you see increases in all of the myeloid lineage. You see eosinophils, neutrophils, and basophils all at high levels. This happens because of a 922 translocation of the BCR gene such that it's next to the ABL gene. And this is often called a Philadelphia chromosome. You can actually see this on a karyotype because it's such a robust transformation. But otherwise, you would normally see it with something like a FISH assessment. Otherwise, imatinib can also be used for gastrointestinal tumors when you see something called a c-KIT tyrosine kinase dysfunction. So that occurs in a gastrointestinal stromal cell tumor, also known as a GIST. Side effects for this drug are pretty tolerable. You see some fluid retention, especially in joints, so ankle and joint swelling, as well as edema around the eyes. The next drug I want to talk about is erlotinib. This again is a tyrosine kinase inhibitor. This drug works on the EGFR, epidermal growth factor receptor tyrosine kinase, EGFR. So it's epidermal, so think solid tumors, right? So this actually works on lung cancer and other solid tumors that are overexpressing this tyrosine kinase. Downside to it is dermal, so it creates an acne-like rash, and it can even cause diarrhea as well. Otherwise, there's the next drug that I want to talk about is going to be sunitinib. This drug acts on the VEGF receptor, so the tyrosine kinase, the vascular endothelial growth factor receptor tyrosine kinase. And so this can work on a whole bunch of cancers that are highly vascular. You test for VEGF and see if these are growing a bunch of blood vessels, and then let's try and strangle this tumor by inhibiting growth factor, this vascular growth factor. Okay, so that's great. The way it works, the downside to this is it can present with, you can develop hyperkeratosis and skin rashes, as well as an increased risk for hemorrhage. So it shouldn't be taken lightly. Another drug, sorafenib, works in a very similar way as sunitinib. It too is a VEGF tyrosine kinase, a VEGF receptor tyrosine kinase inhibitor. And the only difference is really what tumors they're more attuned to, what they can penetrate into better, things like that. So I'm not going to get too far into that. The next one that I want to talk about is vemurafenib. So vemurafenib works on the BRAF pathway, and this is typically found in a V600E translocation of the BRAF gene. So when people test positive for that on a skin biopsy, then you're going to want to treat them with this, as well as excision and the whole 9 yards. So I should say that this drug, vemurafenib, is useful for the treatment of malignant melanoma. So that's where you'll find this BRAF translocated V600E mutation. Okay, so in summation, I want to ask a couple questions here to make sure that you understand what's going on. So what is the mechanism of action of imatinib? Excellent. It works on the tyrosine kinase. It inhibits it, receptor tyrosine kinase. It is especially useful for CML. For CML, what is the histological presentation? Excellent. High neutrophils, high basophils, high eosinophils. Just high white count, myeloid cells. What's another name for a 922 translocation? Fantastic. A Philadelphia chromosome. What other type of tumor can imatinib be useful for? Fantastic. A whole bunch of solid malignancies and hematologic tumors that express an overexpression of this gene, as in especially true in a different case, is the c-KIT mutation in GIST, so gastrointestinal stromal tumors. Erlotinib, what is its mechanism of action? Good. It inhibits EGFR, epidermal growth factor receptor. So with epidermal growth factor receptor in mind, what is the side effect that you'll expect? Excellent. An acne rash, and actually also diarrhea. And what kind of tumors is this typically used for? Yeah, any tumor that's going to express this gene, not excluding lung cancers. Sunitinib, what is that one? What is its mechanism of action? Fantastic. VEGF, receptor tyrosine kinase inhibitor. What is sorafenib's mechanism of action? Excellent. Same. VEGF tyrosine kinase inhibitor. What are its uses? Right. Any tumor that's going to that you find expressing VEGF overexpression. So, for instance, renal cell tumors or hepatocell tumors, they typically express this in abundance. So, what are some side effects of these drugs? Fantastic. They can have rashes, they can present with hyperkeratosis, and they can have a higher risk for hemorrhage. All right, so what is the last drug that we mentioned today? Excellent, vemurafenib. And what is its target gene? The BRAF. Excellent. What kind of cancer is this especially useful for? Fantastic. Malignant melanoma. That expresses a V600E BRAF mutation. All right, so that's it today. God bless you. Stay strong. Be amazing, Europa.